Hello, I'm Willy Pertot. I'm a practicing endodontist in Paris and one of the co-developers of the WaveOne Gold instruments. These reciprocating instruments exhibit a number of enhancements over traditional rotary wtih files. In addition to their incredible flexibility and extraordinary resistance to fatigue, they have been engineered to follow what is undoubtedly the most straightforward protocol I've ever seen. Let's walk through that protocol. I want to show you the basic step in this plastic block. Now we all know that a plastic block is not a tooth, but the concepts are the same whether you're working in curves like this or a tortuous mesiobuccal canal on a molar. As with any file, good access and good irrigation are keys to success. I'm starting with my number 10 file to negotiate the canal. I'll irrigate the space with sodium hypochlorite. I like using a 5% concentration. Then, I drop my hand file in and confirm patency, while at the same time breaking up loose debris between every step of our process. I'll also flush the space with more sodium hypochlorite. Once I've established my length, I'm going to develop my glide path. I'm using the Pro Glider for this. It's taken gently to length in a push and pull motion. The irrigation recapitulation irrigation protocol is followed again. Then, it's time to introduce the primary WaveOne Gold to develop the shape. You will start nearly every case with the primary, which is a 25 at the tip with an 0.7 taper. Just let the file do the work. The only action you have to take is to brush a bit to free up some space at the coronal aspect of the canal. Don't try to push it. When the instrument is done progressing easily and you feel you need to put more pressure on it, just remove it. Clean the file, irrigate, recapitulate, and irrigate again. Don't try to make it to the working length in one pass. Reintroduce the same WaveOne Gold primary. Let it cut further like you see here. Remove it again. The flutes need to be cleaned after every passage. It will make your file more efficient and you will avoid pushing debris apically. Go through the irrigation, recapitulation, and irrigation steps again. Now you are 2 or 3 millimeters away from your working length. The WaveOne Gold primary is used again in the same manner. Let the file go, cut out, cut deeper, out, cut deeper, out. Every time you go in, the file has to go deeper. Never cut at the same level over and over again. That is how you block a canal or create a ledge. Once you've reached length, you're done. Remove the file. If after gauging your foramen size is 25, you're done with the shaping. Then it's on to a good disinfection protocol. Shaping a canal takes just a minute or two. That will give you plenty of time for disinfection. Remember, irrigation is most efficient when your shape is complete. So take advantage of your shorter shaping time and spend more time on your cleaning and disinfection. Matching the tapersha points combined with a quality sealer complete these steps, and you are on to restoring the tooth. Remember, no root canal is complete without a restoration done with the same kind of care that you put into the shaping, disinfection, and obturation of your tooth. Of course, there are variations of anatomy which require slight modifications of the technique. We'll address those in another one of these clips. In the meantime, these basic steps will, with a little practice, have you well on your way to handling 80 to 85% of the cases you encounter. That's how it works in my practice, and I'm certain you will find similar success.